Are you tired of feeling constantly on edge and worried about your health? If you have high blood pressure, you're not alone. You know that 1 in 3 adults in the US has high blood pressure? That's a staggering number, and it's a problem that's only getting worse, but the truth is, hypertension doesn't have to control your life. In this video, we'll explore some of the most effective ways to manage high blood pressure and improve your overall health and well-being. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything and our goal is to promote it. What is it? Blood pressure is a measure of the force of blood against the walls of your arteries as your heart pumps it through your body. It's measured in millimeters of mercury, mmHg, and is usually given as 2 numbers, systolic and diastolic. Systolic blood pressure is the higher number and represents the pressure when your heart beats, while diastolic blood pressure is the lower number and represents the pressure when your heart is at rest. Types of blood pressure. High blood pressure or hypertension. This is when the pressure of blood in your arteries is consistently too high. Hypertension is often called the silent killer, because it usually has no symptoms but can cause serious health problems over time if left untreated. Low blood pressure or hypotension. This is when the pressure of blood in your arteries is consistently too low. In most cases, low blood pressure is not a concern and does not cause any symptoms. However, in some cases, it can lead to dizziness, fainting, or other health complications. Causes of high blood pressure. Genetics. High blood pressure can run in families, so if your parents or close relatives have hypertension, you may be more likely to develop it as well. Diet. A diet that is high in sodium, saturated and trans fats, and cholesterol can increase your risk of developing high blood pressure. On the other hand, a diet that is rich in fruits, vegetables, whole grains, and lean proteins can help lower blood pressure. Lifestyle. Certain lifestyle factors can contribute to high blood pressure, such as lack of physical activity, smoking, and excessive alcohol consumption. Underlying health conditions. Certain health conditions can increase your risk of developing high blood pressure, such as diabetes, kidney disease, and sleep apnea. Age and gender. As we age, our risk of developing high blood pressure increases. Men are also more likely to develop high blood pressure than women until women reach menopause. Environmental factors. Factors in our environment, such as stress, pollution, and noise, may also contribute to high blood pressure. It's important to note that in many cases, high blood pressure develops gradually over time and may have no identifiable cause. However, making lifestyle changes and managing underlying health conditions can help lower blood pressure and reduce the risk of serious health complications. Effects of high blood pressure. High blood pressure, or hypertension, can have serious and potentially life-threatening health consequences if left untreated. Here are some of the potential effects of high blood pressure. Heart disease. High blood pressure can damage the walls of your arteries, making them more susceptible to plaque buildup and narrowing. This can increase your risk of heart disease, including coronary artery disease, heart attack, and heart failure. Stroke. High blood pressure can cause damage to the blood vessels in your brain, increasing your risk of stroke. In fact, high blood pressure is the leading cause of stroke. Kidney damage. High blood pressure can damage the blood vessels in your kidneys, reducing their ability to filter waste from your blood. Over time, this can lead to kidney disease or even kidney failure. Vision loss. High blood pressure can damage the blood vessels in your eyes, leading to vision problems or even blindness. Sexual dysfunction. High blood pressure can also affect sexual function in both men and women, leading to issues such as erectile dysfunction and reduced libido. It's important to note that high blood pressure may not cause any symptoms in the early stages, which is why it's often called the silent killer. Regular blood pressure checks are essential to monitor your blood pressure and catch any potential issues early on. Natural ways to control your blood pressure. Importance of a healthy diet. Eating a healthy and balanced diet is crucial for maintaining optimal blood pressure levels. Foods that are high in fiber, whole grains, fruits, vegetables, and low-fat dairy products are known to be effective in reducing blood pressure. Fruits and vegetables, as they are low in sodium and high in potassium and magnesium, which are known to help regulate blood pressure. Some examples of potassium-rich fruits and vegetables include bananas, sweet potatoes, avocados, spinach, and broccoli. Some examples of magnesium-rich foods: spinach, almonds, cashews, black beans, edamame, avocado. How reducing sodium intake can help. Reducing sodium intake can have a significant impact on lowering blood pressure. Here are some numbers to keep in mind. The American Heart Association recommends that adults consume no more than 2,300 mg/mg of sodium per day. But ideally no more than 1,500 mg per day for most adults on average. Americans consume about 3,400 mg of sodium per day, which is well above the recommended limit. For every 1,000 mg of sodium reduction, systolic blood pressure can drop by up to 5 mm of mercury. To reduce sodium intake, it is important to limit processed and packaged foods. Exercise regularly. Regular physical activity can help control blood pressure and improve overall health. When you exercise, your heart works harder, which helps to make it stronger and more efficient at pumping blood. This reduces the pressure in your arteries, which in turn lowers your blood pressure. Reduce stress. High levels of stress can contribute to high blood pressure. One effective way to reduce stress is through deep breathing exercises. Taking deep breaths and focusing on your breath can help to calm your mind and lower your blood pressure. Meditation and yoga are also great ways to reduce stress and promote relaxation. Other stress-reducing activities include spending time in nature, listening to calming music, practicing mindfulness, and engaging in hobbies or activities you enjoy. Get enough sleep. Getting enough sleep is an important factor in maintaining healthy blood pressure levels. Chronic sleep deprivation can lead to high blood pressure and increase the risk of heart disease. Lack of sleep may cause disruptions in the body's natural processes, including the production of hormones that regulate blood pressure. It is recommended that adults get 7 to 8 hours of sleep per night to maintain optimal health. Medication. If lifestyle changes alone are not enough to lower blood pressure, medication may be necessary. There are several different types of medications that can be used to treat hypertension, including diuretics, ACE inhibitors, beta blockers, and calcium channel blockers. Your healthcare provider can help determine which medications are right for you based on your individual needs and medical history. Alternative therapies. Some people may choose to incorporate alternative therapies into their hypertension treatment plan. These can include practices like yoga, meditation, and acupuncture, as well as supplements like garlic, fish oil, and CoQ10. While these approaches may have some benefit, it's important to remember that they should not be used as a replacement for medical treatment. It's important to note that managing high blood pressure is an ongoing process, and regular monitoring and follow-up with your healthcare provider is crucial. It may take some trial and error to find the right combination of lifestyle changes and medications to effectively manage your hypertension, but with time and effort, it is possible to lower blood pressure and reduce the risk of serious health complications. Thanks for watching. Please visit our website www.meducatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.